All right, good morning Queensland and good morning Rocky. It's wonderful to be in Rockhampton today, and of course we're here to also announce our COVID update, but also to talk very seriously about the need for this region to get vaccinated. So in good news today, I can say it's a double donut day, so well done Queensland, that's remarkable, but this means it's our window of opportunity to get vaccinated. We've done 8,332 tests in the past 24 hours. We've done 13,184 vaccines by Queensland Health yesterday, but we need to see more vaccines. And we're at a vaccination hub here in North Rockhampton, and it's open. They accept walk-ins. The Mayor and the local members will talk more about that in a moment. And I'm also joined today by Dr. Young as well, and the Treasurer. So we now have 72.47% of Queenslanders of eligible Queenslanders have had their first dose, and 56.9% are fully vaccinated. Now, of course, everyone knows that yesterday we announced our plan to reunite families for the festive season. Now, what that means is we have this window of opportunity where I need people in central Queensland to come and get vaccinated. Now, this region is one of the lowest regions in the state. Now, that's a problem. It's a big problem because the virus will come here and the virus will search out for those people who are unvaccinated. So we have 12 days, Queensland, 12 days for people to come and get vaccinated if you want to be fully protected by the 17th of December. So please, if you have not been vaccinated, it is very easy, and we are also opening up some more vaccination hubs in Gracemere and Blackwater at the local schools on this Saturday to also help with this effort. Essentially, we have about 400,000 Queenslanders across the state that are yet to be vaccinated. This is absolutely a critical time in dealing with this pandemic, that we get those 400,000 people to come out and get vaccinated. We know when you're at 80% double vaccinated, it gives a lot more certainty to your community, and you will be able to feel very safe. But at the moment, I'm looking here at Central Queensland, 62.9% have had their single dose and 47.9% have had their second dose. So those figures are not good enough. My job is to keep you safe, but now it's over to you. It's over to you. There is plenty of vaccine. There is no reason why you cannot go and get that vaccine. So please go and do so. So with those few words, I might hand over now to Dr. Young. And then, of course, we've got Barry and Brittany and the Treasurer and the Mayor, Tony, will say a few words, and then we'll take some questions at the end. Thank you.
Thank you, Premier. Well, it's a beautiful day in Rockhampton, a perfect day to come out and get vaccinated. So we've had no new cases in Queensland due to the tremendously well done work by Queenslanders. We have no active outbreaks. But the only way to stop active outbreaks going forward now is to get vaccinated. So every single Queenslander, 12 years of age or older, please check in your local community where you can get vaccinated. There's many, many places. Pharmacies, GPs, vaccination hubs. There are lots of places. And you've got, as the Premier said, 12 days to do it. Because after that, we will be bringing in virus through the borders in vaccinated people, because we know that once you're vaccinated you still can get infected and transmit it, but you're very unlikely to get unwell, very unlikely you're going to end up in hospital. So every single Queenslander is going to get exposed to the COVID-19 virus and will get infected. But if you're vaccinated, that's not a problem. So today, tomorrow, the next day, get vaccinated if you haven't already been, and get your second dose if it's 3 weeks since your first dose for Pfizer, 4 weeks for Moderna. Thank you.
Well, Rockhampton and Central Queensland have done so well. Rockhampton and Central Queensland have done a wonderful job, particularly during the depths of the pandemic when it comes to economic activity, whether it be agriculture, mining, tourism. The economy generally has performed so well during the depths of the pandemic. We just can't afford to let all that good work go to waste. We just can't afford to let all of that great economic activity, all the jobs we've been able to create, all the jobs we've been able to sustain slip away. We have to push on. Now, Central Queensland, now is the time to push on. We need to redouble our efforts and get people vaccinated. We don't want the people of Central Queensland to be harmed. We don't want the economy of Central Queensland to be harmed when the Delta variant arrives. And make no mistake, Delta is coming. Delta is coming to Central Queensland. It is coming to our state. And the way to protect yourself, your family, your friends, your business, the local economy, all the businesses you support here, all the businesses you want to be successful, the way to protect them is to get vaccinated. There is no time to waste. You need to get vaccinated this month. You need to get your first shot by the end of October to ensure you are fully protected when we get to 80% double dose by the middle of December. So it's a call to arms and a call for arms in Central Queensland. Make sure you roll up your sleeve, come to a clinic and a vac centre like this, get vaccinated. It's simple, easy, painless, it takes very little time and it'll keep you safe. The other message we want to communicate today, the other message we want to say today is don't miss out. There'll be some businesses that will of course be able to change how they operate, and they may say only vaccinated people can enter our business. So if you want to go to the pub, the club, another licensed venue, see live music, go to a concert, the safest way to ensure you'll be able to do all of that and spend time with your friends and your family and not get sick is to get vaccinated and to get that double dose, to get the 2 doses of the vaccine as quickly as possible. That's our call today, and we're calling on everyone in Central Queensland across the state to get vaccinated and to get vaccinated today.
Thank you. Barry, Brittany and me.
Good morning. I'm really calling on all Central Queenslanders to get vaccinated, particularly our younger people, our 20 to 39-year-olds. If you're not vaccinated, what's going to happen at Christmas time? You know, a lot of us are out and about socialising at pubs and clubs, having a cold beer during that really stinking hot weather. It's up to you. It is up to you whether you get to be out and about, whether you get to go night clubbing and things like that. It is your responsibility to now get out and get vaccinated because it means so much. And think about the other people around you. You know, without active vaccination up to that 80%, we're putting people at risk. Our health system, for example. You know, our doctors and nurses do an absolutely marvellous job. But can you imagine if we end up with a wave here and we're going to have COVID here, the impact that's going to have on our local health facilities? Come on, please step up. You've just got to.
Thanks, Barry. Good morning, everyone. Brittany Lauger, State Member for Keppel. Central Queenslanders have done so well in suppressing COVID and keeping COVID out of our community. And over the years, we've done so well at responding to natural disasters, whether it be floods or fires or cyclones. And we prepare. When we know that there's a disaster coming, we prepare. We sandbag, we get the food ready, we put the batteries in the radio, we prepare. And we're really, really good at that here in Central Queensland. What we've got coming is like a natural disaster. It's like another cyclone or a flood. We prepare for a flood, we get the sandbags out. With COVID, it's coming. The COVID waters are rising, and we have been doing everything that we can to date to keep it at bay, but COVID is going to break its banks in Central Queensland, and we really need to be ready. So I'm asking all of Central Queenslanders to really consider getting vaccinated as soon as possible. It is really important for not just us as individuals, but for our families and our entire community. We know that children under the age of 12 can't get vaccinated currently. And my daughter, it's her 4th birthday today. She can't get vaccinated. Let's do this for our children, for the immune compromised people in our community, the people with cancer or diabetes or leukemia. They need us to get this jab to help keep our community safe and to keep those people who can't get vaccinated, like our children, safe as well.
Okay.
What I'm here today to say is for those members of our community that are not vaccinated is to line up and get those vaccinations. We're seeing the numbers across the state, in the southern areas of our state, those percentages are really high, but unfortunately in the regional areas we've become a little bit complacent because we feel that it's not coming into our neighbourhood. Well, now's the time to really man up and woman up and get those jabs and be in that area where we need to lift the percentages up. Again, for our family, our friends, our businesses, for the tourism, it's something there that we need to not to have impacted if we don't get those vaccination rates up. So sending the message out to the community, we've got a window now, we can take advantage of that, make sure that we all line up and get those vaccination rates up with the rest of the state. Calling on our community to do that, and it's something there that I believe we can do it, and I'm calling on the community to take that advantage and get on board now and get vaccinated. Thank you.
We're happy to take some questions, but I just wanted to also say too, there are a lot of families here who have friends and loved ones in Brisbane, other parts of Queensland, in New South Wales, Victoria, in other parts of Australia, and people will be travelling. Now, what that means is we've put in a very strict criteria that people have to be fully vaccinated to come here. But I can't tell you when the next Delta outbreak is going to happen. And the last thing you want to see is that outbreak happening here on your doorstep. If it comes through this region with your vaccination rates at the moment, it will cause a lot of damage and a lot of heartache. So now is the time to step up for yourself, for your family, for your friends and for your community. So please, as Dr. Young said, come out and get vaccinated today. We've got 12 days, Queensland. Let's do this.
Will Queensland reopen to hotspot travel when the state hits 80% double dose or when we hit 80% fully vaccinated?
What I said very clearly is that the date is set in concrete as the 17th of December.
Once we hit that 80 or 90%, will restrictions and masks even be needed at venues?
Look, my advice, and Dr. Young can probably talk a bit more to this, but when we hit that 80% double dose across Queensland, the requirement for masks will not be needed. So that's good news.
Can you detail what restrictions?
But can I just say, if there is an outbreak in an area, there may be restrictions put on that area if they have not got that 80%. So, for example, in Rockhampton, if we had a massive outbreak here, there may be restrictions that will be put on, and we don't want to see that. That's why I want everybody to go out and get vaccinated.
Can you detail what restrictions will apply to people who are unvaccinated under that phased program?
Well, that's a very good question. So the question is about what are the restrictions that will be placed on unvaccinated people. Now, as you heard from Barry, the biggest age group that we need to get vaccinated is that 20 to 39. Our elderly population have been fantastic. They've come out in droves to get vaccinated, but it's that 20 to 39-year-old age group. We really need them to come and get vaccinated. So what businesses may do, and you can't rule this out, they may actually say only vaccinated people can come into their pubs or their clubs or their restaurants or their sporting games, because that is about ensuring everybody is safe at those venues. So I don't want people to be left out, so please come and get vaccinated. Go to your local GP, go to your local pharmacy, come to a vaccination centre. We've got further schools that will open this weekend. We had Bunnings that were open last weekend. We're looking at doing more Bunnings in the future. We're trying to take the vaccine to as many people as possible.
What protections will businesses have if they need to turn unvaccinated people away?
Well, that's a matter for them, but they may look at putting in place measures to only allow vaccinated people into their venues.
Is there anything other than travelling into the states that the government will prevent people from doing?
In terms of what do you mean?
Being unvaccinated. I mean, it's the business's prerogative too.
Well, at the moment, if you can come back in. If you come back into Queensland, you have to be fully vaccinated and show a test that you are COVID-free for 72 hours. We are trying to minimise the risk, but if you are unvaccinated, you have to go into a hotel quarantine. So that's a pretty good incentive that if you want to travel to other parts of Australia, go and get vaccinated.
If cases remain high in Victoria, will the border open up?
The date is set in concrete as the 17th, but let me say this. The vaccination rates in New South Wales and Victoria are very encouraging. Now, when I said I'd like to see 90%, and I think we will get to 90% in some parts of our state, it would be wonderful if all of Queensland got to 90%. But New South Wales is at over 90% first dose. ACT is about 97%. Victoria's climbing up there as well. So come on, Queensland, let's beat our southern rivals.
Would the government look to restrict unvaccinated people from entering government-owned facilities and workplaces?
We will look at all of those issues. We haven't canvassed those issues at present.
How long will QR codes remain mandatory? Will that stop at 80% or 90%, or is it here to stay?
We need to keep up with those QR codes. That is critical, because even when we have the Delta outbreaks, which we will see, we have seen them already in Queensland, but in regional Queensland has largely not have had those lockdowns that have happened in Brisbane. So if you don't have your high vaccination rates, you've got a higher chance of having the virus rip through your community. So that's why we need people to get vaccinated.
What do you say regarding Gold Coast Mayor Tom Tate's comments that businesses will be broke by the time that December deadline rolls
Look,
around?
I addressed this. I addressed this morning. I said recently I was down at Burleigh. You could hardly find a restaurant or a cafe that you could sit down and have a cup of coffee at. It was packed. It was absolutely packed. Now, I appreciate some parts of the Gold Coast are doing it tough. Other parts are booming. The best thing that Tom Tate can do is get out there and tell his city to get vaccinated. They are close to the border. When people come across the border to see family and friends after the 17th of December, a lot of people will come by road, and they will be stopping at the nearest cafe, coffee shop, fish and chip place on the Gold Coast to entertain their friends and family. So that is why it is absolutely critical that the Gold Coast steps up, because they are lagging behind Brisbane at the moment. And I know Gold Coasters can get their vaccination rates up just as people here in central Queensland.
You said you were quite set in stone about the date being
Yes.
in December 17. What are your thoughts on the fact that Tom Tate wants to see it brought forward to November 25?
Well, it depends on the whole state getting 80% fully double dosed. So we have said that it can come forward, but if you want to have full immunity, like Dr. Young said, December 17 gives Queenslanders that immunity if they get vaccinated. We need 400,000 people to get vaccinated in the next 12 days.
Is there any possibility of this state closing again after you've opened up, and if so, under what scenario?
Well, you're seeing all the states and territories lift their vaccination rates, so it would be highly unlikely, highly.
Based off the modelling you've done in relation to the reopening plan, how many deaths are predicted in the worst case scenario?
I might get Dr. Young to address that modelling. That modelling was done independent of the government, but in terms of cases, our worst case scenario, we were looking at 1,200 cases, but it could be around 400. But, you know, look, can I just say to Queenslanders, you don't want to be that person who is sitting at home and thinking, I don't think I'll get the vaccination. Because if you get the virus, you could end up in ICU. And think about your family and friends then, and how they will feel, and how you will feel. A lot of people have ended up in hospital. This is a very serious disease. It's not like the flu. It is a very serious disease. And you don't want to be one of those unvaccinated people who end up in ICU.
Just on home quarantine, what sort of staffing, resources, police will be required, and would it be capped?
Well, it becomes uncapped in the middle of next month. We've got that trial happening at the moment, but like I said, you have to be fully vaccinated for home quarantine domestically. Yeah.
Do you think parents have a right to be concerned about children who aren't eligible to get vaccinated yet?
I'm very comfortable that the TGA has said that they are looking at the vaccine and the Pfizer vaccine for children. They're running tests at the moment, and there is some evidence about the immunocompromised children being a priority for that vaccine. But the best way you can protect your children is to get vaccinated. We're going to have the 12 to 15-year-olds vaccinated, and if we get the whole adult population vaccinated, guess what? That protects the young children.
What is the capacity now for ICU beds in Queensland?
there's a lot of ICU beds. Dr. Young's been preparing for this for 10 years. So she can address that in a moment. Any other questions for me? And I'll hand over to Dr. Young.
Just finally, on the ashes, given Brisbane will soon host the ashes at the Gabba, will everyone going have to be vaccinated, and would you support that?
We'll have a look at those issues when it gets closer to the time. I don't think there's been any final decisions made about that at the moment. But what I do know is that in Brisbane, the vaccination rates are really high. So in Brisbane, the vaccination first dose is looking at over 80%. So I'm very comfortable where Brisbane is. I'm not very comfortable where the rest of Queensland is, and that's why my ministers are out and about across the length and breadth of Queensland this week, driving home one key message: get vaccinated. Vaccinate, vaccinate, vaccinate. I can't be clearer. Dr. Young?
Just sorry, does the state government need to implement more vaccine mandates like for teachers?
Look, the Police Commissioner has said that for police officers and the health workers in our public health system and aged care workers, so people who are right on that front line. We have encouraged teachers and cleaners and people who work in schools to come and get vaccinated. We've said they can go to the front of the queue, but now we've got walk-ins. So there really is no excuse for people not to be vaccinated.
Tourism operators finally have some certainty now across Queensland. We're going to see an influx of intrastate and interstate tourism for Christmas. Is it exciting to see, the businesses that finally have that certainty of business?
I think what I can say to that is Queensland has been open. Like, we are very blessed that other states have been in lockdown and their economy has suffered. You've got the Treasurer here today. Our economy is open. We've had Queenslanders going and supporting Queenslanders with tourism, with hospitality, going out, enjoying life as if, we have not been impacted like other states. But that is going to change unless we are fully vaccinated. So everyone, please go and get vaccinated. It's the best thing you can do. And Dr. Young, just on those issues, thank you.
So QIMR Berghofer did modelling based on the Burnett Institute's methodology, and they showed that if the state borders are opened up at different levels of vaccination, that eventually we'll end up with a maximum of 1,200 cases per day by August of next year. Now, our health system can manage that. So that is an average across the whole state. So you will end up with clusters in different parts of the state, but we know how to respond to those. We've responded to those for the last 22 months. So that's what we'll be doing. So if we have an outbreak in one area, such as Rockhampton, we'll use all of the tools that we've been using for the last 22 months. I hope that we don't need to. I hope that you take up the most important tool of all that we did not have 22 months ago, and that's vaccination. So there's absolutely no need for us to use any of those tools of requiring people to stay at home, of putting restrictions on businesses, of 1 per 4 square metres, of only being able to eat or drink seated. We won't need to do any of those things if you get vaccinated to those higher levels. But if there is an outbreak, then we can use all of those strategies. They're well tested. We know how they work. We can put them in place very, very quickly now. And then to answer your comment about the QR codes, we need those because we know, and the modelling's used that fact, that the quicker we can contact trace, the quicker we can then end those restrictions, because we can get those close contacts into quarantine so that we don't then have ongoing spread. So those QR codes are absolutely essential, and in areas that there isn't the same level of vaccination, they're even more important. So if you want to get rid of those QR codes down the track, which I'm sure we all do, you need to have very, very high vaccination rates. So that's all important. Now, another question was ICU beds. So we normally in Queensland run about 300 ICU beds. We flex our ICU beds up and down depending what we need. We don't have empty ICU beds because they're very, very expensive because of the staff that are needed. But we've trained more staff And we've also identified areas that we can safely put increased ICU capacity. So we've got plenty of beds, of course, we've got plenty of ventilators, we've got all the consumables, and we've got trained staff. So we can rapidly increase that to 600 beds. Now, worst case scenario, and this is genuinely worst case scenario, with no mitigating factors, the QIMR Berghofer modelling suggests we might need up to 400 ICU beds. I don't think we will, because we'll put in place those mitigating factors. We'll make sure that we put in place the restrictions to limit the spread when we start getting outbreaks. But if we did have worst case, we've got the capacity to manage it.
Just on that modelling, how many deaths is predicted?
Well, it really depends. So we'd have to look at that. That modelling's available, so you can go and look at it and look at the different age groups. But it just actually depends on who gets vaccinated. So that's the most important thing to do. It's really, really critical, and we need to do it now, because it's too late, as some poor people in Sydney were asking nurses to get vaccinated while they wanted to be vaccinated themselves, while they were being put on ventilators. It's far too late. You've got to be vaccinated today, because you'll need a second dose in 3 weeks for Pfizer, 4 weeks for Moderna, and then it takes another 2 weeks after that before you get full protection. So you need that solid 5 or 6 weeks. And no one knows, except that we're opening our borders and we are going to have people come into Queensland. Other than that, no one knows when our outbreak will be and which part of the state it will be, because it will just happen. So the best way is every single person 12 years of age or older gets vaccinated in the next couple of days, because then we could open up before the 17th of December.
Can you just explain, how the home quarantine will work?
As it's working at the moment. So we've got a trial and it's been extraordinarily successful. So we've now got 1,000 people who are coming into Queensland to home quarantine. So the trial at the moment, people need to come into Brisbane Airport and they need to be within a certain distance of the airport, and then they go home, they get tested day 1, day 5 and day 12, and they need to be in quarantine with all their family. Now, to be able to come into the state, and this will continue, they need to be fully vaccinated, which is 2 doses of a vaccine plus 2 weeks after that. And they also need to have had a COVID test done within 72 hours of arriving into Queensland, and it needs to be negative. So all of that has to be in place. Now, when we open up in mid-November, people will be able to fly into the state anywhere in the state and go home from there. But they must fly, they can't drive. That won't happen till December. The reason being that we can't risk that people who are potentially infectious are driving through Queensland. We're a very, very big state. So people need to fly in. They need to make sure that they've got a safe way of getting from the airport to their home. So someone needs to leave a car for them at the airport ideally, or someone come and pick them up. But if someone comes and picks them up, they'll be going into quarantine with them. They need to have had those 2 doses of the vaccine plus 2 weeks after that, a negative COVID test within 72 hours, and then day 1, day 5 and day 12, and anyone else in the household who's quarantining with them, all of them day 12, they need to go and get a COVID test, and they need to go to a facility, and you've got a perfect one here in Rockhampton, that you drive through, so they don't put other people at risk. So they need to drive through to have that test done. So it's quite complicated, but it will keep people safe while we build up the vaccination rates. Once we've got to 80%, people won't need to quarantine and they can drive or they can fly.
And will other household members already in Queensland have to complete the quarantine with someone who arrives from interstate?
Yes, as I just said, everyone in that household and anyone who's in the car with them when they go and pick them up from the airport will have to quarantine. They don't need to be tested day 1 and day 5, but they do have to be tested day 12.
All good? Thank you very much.
Thank you.